it is the worst nightmare for every parent. In the second wave of the pandemic, children were previously untouched find themselves at the receiving end. There's a huge surge in the number of pediatric COVID cases. Here is what you need to know.
The second wave of the COVID pandemic has spared no one, not even little children. At an alarming rate now, children as young as 5 years old are getting severely affected by coronavirus.
10 दिन पहले कोविड रिपोर्ट पॉजिटिव आई थी मेरे बेबी की। स्टार्टिंग में थोड़े से लूज मोशंस हुए, बट फिर लूज मोशंस बढ़ते बढ़ते इतने बढ़ गए कि घर पे मैनेज नहीं हुआ, तो इसलिए हम लोग उनको हॉस्पिटल लेके आए। हॉस्पिटल में फ्लूइड्स, आईवी फ्लूइड्स चले और मेडिकेशंस भी चली, एंटीबायोटिक्स भी चली।
At Madhukar Rainbow, a children's specialist hospital in Delhi, doctors recorded 50 pediatric cases of COVID in 1 week.
The situation is indeed alarming compared to 2020 because in this season of COVID outbreak, we are seeing much more pediatric age group, younger age group. So therefore parents need to be cautioned that we cannot drop the guard. We have to continue with all the precautions and get the medical attention as soon as required.
Doctors confirm that even newborns and infants are turning COVID positive, though their condition is not fatal. But experts add that older babies are at greater risk. At one hospital in South Delhi, a teenager, COVID positive, is battling for her life, dependent on a ventilator. In Faridabad, Poonam Sharma is under home isolation with her 10-year-old daughter since the 1st of April. The whole family has been infected by coronavirus.
On 1st of April, my entire family was tested COVID positive, including my 10-year-old daughter. We were obviously very much devastated, and it was unbelievable for all of us since we didn't step out of the house during the pandemic at all. We were not at all panicky in front of her, so she was quite normal and she thought it was a normal fever, cough and cold. These were the symptoms we all had in our house.
So what are the reasons behind the surge of cases among children? Experts claim a new mutant strain could be responsible, also lack of caution among family members as compared to 2020. There's also the issue of increased exposure, particularly in vulnerable areas, and the fact that there's no vaccine yet for children.
In 2021, globally we are seeing a lot of children, almost up to between 20 and 40% in certain areas, to get infected. The T-cell immunity, the lack of ACE receptors in the nasal passage in the throat, and the other interleukins which are protective proteins in the body somehow don't seem to work.
So as a parent, what are the symptoms you need to watch out for in your child? We spoke to doctors who said that gastrointestinal issues, rashes, conjunctivitis are symptoms to watch out for. In cases of delayed response, multi-system inflammatory syndrome is also a symptom. Most importantly, if you see these symptoms, do not self-medicate and contact your doctor immediately.
Across Delhi NCR, over 25,000 cases are being reported on a daily basis. Many include the pediatric age group. Also across Europe and Brazil, children deaths are being reported. So India would do best to exercise caution and prepare in this war against the COVID pandemic. Pooja Shali for India Today.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.